Stem cell transplants are really almost a routine treatment done in multiple myeloma these days. Stem cell transplants refer to the stem cells from the bone marrow. And so bone marrow stem cells can be obtained from the patient themselves, what we call an autologous stem cell transplant, or they can be obtained from a relative, usually a sibling, and that's called an allogeneic stem cell transplant. And really the concept of a stem cell transplant, particularly the autologous stem cell transplant, is a way in which we can deliver bigger doses of chemotherapy. We know that drugs like melphalan are really important drugs, and the higher the dose that we give of those drugs, the better. The problem was that we reached a ceiling of the dose. In other words, as we pushed the dose of melphalan up, we got a higher response. In other words, a bigger kill, a deeper response, less myeloma. But then we hit this ceiling effect where you couldn't give any more drug because of the effect on the innocent bystander cells, the platelets and the white cells. So what would happen is that you give a big dose of melphalan, but as a result, the length of time for low counts and needing blood transfusions was weeks and weeks and weeks and weeks, which made it just too unsafe for the patient. So what we discovered was that you could actually take somebody's stem cells. Initially it was directly from the bone marrow, so patients actually had a bone marrow a harvest where bone marrow was removed from the bone marrow area in the pelvis by an operation. And then the patients would get a big dose of melphalan, so kill off the myeloma, but the stem cells that were collected were then reinfused. So they had been frozen away, reinfused back to the patient just like a blood transfusion, and they literally make their way back to the bone marrow within about an hour. And then what they do is that they grow, they engraft, and about 7 to 8 days later they start to repopulate the bloodstream. So you get this rapid recovery, which makes the whole process very short. Compared to weeks and weeks, it only becomes a few days to a couple of weeks. Now we can actually collect those stem cells, those most immature bone marrow seeds, from the bloodstream. So we just give the patients an injection, we collect the stem cells directly from the bloodstream on what's called an apheresis machine. So to put it simply, what happens is the patients have their stem cells collected from the blood, then some weeks later they get a big dose of melphalan, stem cells are reinfused, and you get rapid recovery. So what you have is you have deep death of the plasma cells, the myeloma gets down to its minimum amount, and the blood counts are recovered. A stem cell transplant from somebody else, a so-called allogeneic transplant, same principles, except we're collecting those stem cells from usually the sibling. The patient gets the chemotherapy, then the sibling stem cells are reinfused. What happens in that situation is not only do you getting normal bone marrow, white cells and platelets that are being formed, but the immune system is actually replaced. So you get, for example, a man might get his sister's immune system, and that immune system has the capacity to recognise and kill off the myeloma. Part of the reason we think myeloma survives in a patient's body is because it becomes very clever and escapes the attack of that person's immune system, that normal immune system. So when another immune system is put in, it's better able to attack the myeloma. The downside of that is that sometimes that immune system can become overactive and actually attack the recipient, the patient who's receiving it, and that's called graft versus host disease. And that can sometimes be a very dangerous thing to occur. So a bone marrow transplant or a stem cell transplant from somebody else is actually a relatively riskier procedure than a transplant from oneself. And it's only done quite rarely in patients with myeloma, and patients generally have to be younger and fitter to be able to receive a bone marrow or a stem cell transplant from somebody else.